the mother says something and you directly, no, it's not like this. You need to take this vaccine because of this, they are not gonna be open to listen to you. So that's why you need to use this empathy technique. This is the number one.
Welcome back to the WSPID podcast series brought to you by the World Society for Pediatric Infectious Diseases and supported by an educational grant from Takeda. I am Alicia Chen, a pediatric infectious specialist working in Guatemala City.
And I am Daniel Jarowski, a pediatric infectious disease specialist working in Santa Casa de São Paulo, Brazil. We are your host for this episode. To find further resources, you can visit the Global e-learning portal on the WSPID website, your hub for pediatric infectious disease insight.
Today, we are tackling a growing concern in the pediatric infectious diseases field, vaccine hesitancy. Vaccine hesitancy is a growing challenge worldwide, and it can lead to serious outcomes. So, what can we do when we are faced with parents who are hesitant about vaccines?
So to share strategies and advice on tackling vaccine hesitancy, we are pleased to be joined by vaccine and healthcare prevention strategies expert, Melissa Palmieri. Dr. Melissa Palmieri is an MD and healthcare consultant working in São Paulo, Brazil. She's vice president of the Brazilian Immunization Society Regional of São Paulo State. And she's also senior medical officer at Health Secretariat in São Paulo City. Welcome to the podcast, Dr. Palmieri.
Thank you, Danielle, for the invitation. It's my pleasure to be here today to talk something really important for us.
Well, thank you for taking the time, Melissa, to join us today. And we're going to start with a basic question, and I think one that we all have in mind. Vaccine hesitancy is growing and is really a challenge worldwide. From your perspective, what are the key drivers of vaccine hesitancy and in pediatric populations today?
Thank you, Alicia, also to be with me today. And this is a really important matter right now that we are facing. And I think the key ones are related to misinformation, especially social media amplifies false information about vaccine safety, efficacy, and ingredients. Fear of side effects, concerns about potential adverse reactions are common among parents, and trust issues related, especially a kind of skepticism towards pharmaceutical companies and also governmental institutions. This can decrease the vaccine uptake, and cultural beliefs, certain cultural norms and beliefs might discourage vaccination, unfortunately.
Melissa, how has vaccine hesitancy evolved in Brazil specifically over the past decade? Are there specific cultural or social factors maybe influencing parents on what decision to make, vaccinate versus not vaccinate?
Yeah, a kind of increasing misinformation over the past decade. Misinformation, especially through social media, as I said, has significantly increased hesitancy. And cultural factors, diverse cultural backgrounds may lead to different perceptions and acceptance levels regarding vaccines. And here, unfortunately, I need to add political party leading a campaign against COVID-19 vaccines. Of course, we can add access problems, geographical differences inside a country as Brazil, but the main factors are the two I've already said. I believe those are the main ones.
Melissa, have you seen any religious factor influencing vaccine acceptance? Because Brazil is mostly a Catholic country, but do you think it's an issue for the country?
Yes, when you talk about leaders, like if you melt policy and religious, this sometimes can damage if you taking into account the problem that some leaders can raise to have power between the type of their audience. And unfortunately, I do believe sometimes there are some leaders, they connect, especially in Brazil, with political parties here, and this can have a kind of damage. Not also with vaccine, there are some religious leaders that sometimes they say, don't take this medicine for cancer, God is gonna save you. And also with vaccine, why do you need to take this vaccine? Because the natural immune system that God gives you will provide against those pathogens. So I do believe, Danielle, this might have.
All right. If you may I call you Melissa? So
Yes.
now, Melissa,
Yeah.
we've known for a while, right? We both work at in São Paulo, Brazil. Can you share a case where vaccine hesitancy played a critical role in disease outcomes? In your case, or in our case in Brazil?
Yes, Danielle. I will also call you Danielle and Alicia. Yes, I can share what happened with HPV vaccine in adolescents in the year 2014, in the year of its implementation in our NIP. So it happened in a city nearby the city where we live, São Paulo, called Bertioga, in the east coast of São Paulo state. And can I talk?
Yeah, go
Yes.
ahead.
Yeah, yeah. So,
We,
because you may not be curious, but our audience,
I am.
yes,
I wanna hear your version.
yeah, okay. The NIP campaign was conducted inside schools where we know, especially in this age group, is where we can reach better coverage. It happened in the city, in the East Coast, where 10 adolescents developed neurological effects after receiving HPV vaccine. And as soon as it happened, the media spread fear around the safety of this immunization, and anti-vax group spread much more. So after that, we faced a huge decrease in the immunization rate.
Yeah, in fact, at that time, it was one of the highest vaccination coverage in the planet, in the world. So for the first dose, and it decreased significantly for the second, right?
Yeah.
Yeah, that's a very good example. So, and what do you think, based on this case that you just mentioned, what can we learn from it? What are the main concerns that parents had that expressed at that time?
Yeah, I need to talk what happened afterwards. It happened a huge investigation, and especially showed that it was a psychogenic seizure that was potentialized between the colleagues, a well-known adverse reaction that could be averted at that time. Nowadays, we keep trying to revert this damage. Something similar happened in the north area of our country, in Acre state, where an anti-vax group tried to persuade a group of vulnerable families against HPV immunization. In almost a similar situation. But the response was strong and timely, and we are slowly increasing the coverage. Taking into account, in my experience, related to the most common myths or misconceptions regarding the hesitancy among parents, safety for sure is the number one.
Yeah, I agree with you. So, well, this case you just cited, it was HPV. At that time, it was quite new vaccine, at least for Brazil. It was just introduced into our NIP. Now, let's think broader with other vaccines. Have you observed a difference in hesitancy levels between routine childhood vaccines and the newer vaccines, such as those for COVID or the recently introduced in Brazil dengue vaccine, and maybe other vaccines that are being introduced in the private market in Brazil and worldwide? What do you think about that?
So, routine vaccines might be met with less skepticism compared to newer ones due to historical trust and data here in Brazil. For sure, the tolerance for the new is low between parents and childhood vaccines. I always try to build a parallel that human behavior loves to connect with new things like a new cell phone, car, but the tolerance for the new inside preventable and therapeutic areas inside medicine is low. The same people that acknowledge the fastest way new technologies come to their lives refuses for medicines. We as healthcare professionals need to bring light into their own skepticism. There's been increased efforts in schools and communities to educate and build empathy to address concerns of the parents, but unfortunately, Danielle, challenges still remain.
And do you think? Well, we've seen here in Brazil very strong correlation of COVID vaccine hesitancy and political influence. That's clear. I think it occurred many countries. I don't know what Alicia might share her experience in Guatemala, but what I want to ask you, Melissa, is: do you think that the COVID pandemic and, of course, COVID vaccination fueled this vaccine hesitancy in the routine vaccination? Not particularly with the new vaccines, just new vaccine, but the routine. Do you think that how was the situation before, during, and after, and where we are now regarding routine vaccination in Brazil?
For sure, Danielle, during the pandemic, the especially regarding the huge problem we had at that time with political party talking about fake news, spreading this malinformation, all the three of them occurred during this time. We had a huge impact because Brazilians are really confident in our NIP, in our routine vaccine immunization. But unfortunately, right after the COVID-19, okay, there were a new virus. We needed a quick development of a new vaccine to fight against, and with a lot of, I would say, fake news to have everything inside the umbrella. During the pandemic, we do know that the rote immunization was damaged because of access, a lot of other issues, not only regarding the vaccine hesitancy, but access, people remain at home. But after, we are now still working on to recover. Okay, we've already reached inside our country 10-15% more, but we still need to work on because it happened a damage. Definitely it was something really sad. It could happen in a better way, because of course during pandemic there is no good way during it, but we could have a smooth time regarding communication with the population, preserve the health of the population with good information.
Thank you, Melissa. I think it's wonderful the way you have explained to us how it evolved. I believe COVID had a great impact. So afterwards, in my country as well, we haven't really gotten back to the way we were before the pandemic. I think we were in better shape. I think hesitancy wasn't as high as is today, and so that's why we are making every effort to try to improve the information that is available to pediatricians and the public in general. So now we're going to go into effective communication, which I think you already alluded to in the previous segment. So as pediatricians and infectious diseases specialists, we have the parents in front of us, and we would like to ask you if there's a most effective or evidence-based strategy to actually talk to these parents. You already mentioned empathy. I'm not sure if all the time we are able to show that empathy to parents. I think sometimes we want them to do what we ask them to do, and it is hard to be to have empathy with someone that thinks very differently to what you think. So how do you talk to parents, or what would be your advice for pediatricians and PID specialists in general?
Great. For the beginning, when we talk about empathy and facts, I do believe empathy is crucial with the parent hesitant because address feelings first that can open this parent to listen what I need to add after when I need to share evidence-based facts. So when we talk empathy, it's not always telling, oh, it's okay. No, it's just you need to ask, can I see if I understood what you just said? This open the conversation, because if the mother says something and you directly, no, it's not like this, you need to take this vaccine because of this, they are not gonna be open to listen to you. So that's why you need to use this empathy technique. This is the number one. The problem here, Alicia, is that we were use it, especially in Latin America, where the people are really confident regarding vaccination. So we were used to say, oh, you need to take this. And it was not asked anything for the healthcare professional, especially for the medical doctors. So now we need to change a little bit how we need to act to have a success in the goal that we are looking for. So this is the number one. After user relatable examples, simplified scientific facts and stories to convey messages. People are not so, they don't understand easily the numbers. And usually we share numbers. Oh, the rate is, I would say 20% lethality, blah, blah, blah. Or maybe the risk of myocarditis with mRNA, it's like one thunder coming in a lifetime. So then you can simplify the scientific number fact to the person. Another thing is to encourage dialogue. Provide reputable sources after what you explain. Use visuals. For instance, with dengue vaccine, if an adolescent is afraid to receive the shot, you can say, oh, do you know that the needle is the same as diabetic people use? It's subcutaneous, not even get the muscle. I know it's not something that might be comfortable. And then you can bring the person to your side and avoid jargon. Utilize motivational interviewing techniques. For example, oh, I know that you as a father and you as a mother want the best for your children. So you are looking to provide this explanation. You look after my service, I would say. because you do believe that I can also be together with your family, bringing the best to your child. So this is another tip. And continuing always providing information respectfully. Ensure parents feel respected and not judged. This is
Yeah.
really, really important.
I think that's wonderful, Melissa. I think those tips, those techniques are very important. Will really have positive effects on the decisions that parents take about vaccinations for their kids when they are in your clinic. So now let's go back to Daniel.
Well, so Melissa, well, you're well aware that Brazil has a strong history of immunization programs dating from the early 1970s. You work at one of the largest city in the planet. It's really challenging inside Brazil. We know how hard it is to work at the as secretariat for the São Paulo city. So with that in mind, what lessons can the global pediatric community learn from Brazil's approach to vaccine advocacy? And of course, São Paulo, you have experience not only, I know you are well aware of what happens to the country, but also what experience can you share with us regarding the city of São Paulo?
Yeah. So we received an award from Forbes as a World Capitals vaccine. We reached the fastest way, the rate as we received the vaccines. We received this international award in
You mean
some.
COVID vaccines?
Yeah,
You mean
COVID
COVID vaccines?
vaccine. Yeah. And it was, I do believe it was a challenging time for everyone in every place of the world. But the most important, and we were lucky at that time that even the politics inside the city were really open to listen the scientific body inside the health secretariat. So it was needed to do a lot of implementations, a high level of, I would say, accuracy in the communication, in the operation, to vaccinate in the fastest time all the population. And there was, I think it happened in other places around the world, but even in São Paulo, as we had a huge population, we need to reach groups. So imagine every day in our cabinet, people pressuring us. I want to receive my vaccine, but first it was over 60, and after it was we decreased the ages. So I do believe we had situation rooms where all technical bodies were working together for the things happen. And another thing, we say a type of, I would say, mobile clinics. We call in Portuguese vacinação extramuros, so mobile clinics to vaccinate, where we could reach the population. And of course, during the pandemic, it was we developed also a queue tracker for the people to see inside a website if that primary care center had a huge queue or not to receive the vaccine. So we didn't want too many people inside a same primary care clinic. So we had a lot of successful initiatives to overcome the real challenge that we faced. And the communication also, we were in social media fighting against disinformation, talking about the new vaccine, about the strain, why we should take the vaccine. So it was something that I think everyone has a good story to share related to this time, or writing a book.
Yeah, that's right.
Yeah, we all are.
If we move from COVID a little bit and we go to recent dengue explosion of cases in Brazil, for those who are listening to us, Brazil in 2024 was the most hit country in the planet. 1 in every 4 deaths regarding dengue in the planet was in Brazil. So we faced a very difficult times last year.
We
right,
are
Melissa?
specialists. We are
Yeah,
specialists in this.
yeah.
We in the southeast areas, unfortunately.
And unfortunately, we're expecting an even worse year in 2025. Hopefully, I'm wrong with that. But why am I saying all this, Melissa? Because we had implemented a new dengue vaccine last year in the middle of chaos caused by dengue, millions of cases, thousands of deaths, and a new vaccine showed up and was implemented quite quickly in the Brazilian National Immunization Program. Having that in mind, can you share with us any successful public health campaigns or even community-driven initiative that was performed in Brazil that have effectively increased vaccine confidence, and so especially using one of those 2 recent examples, please?
Yeah, it's important, as I said previously, a new vaccine sometimes can be seen like with I would say a kind of misperception, the benefit, or should I take because it's new? So we are facing problems inside the whole country. And when I say problems, when I talk about São Paulo city, always we have a high number if we compare between the low numbers, comparing with the state and comparing with the country, because it's not because we are the best. No, it's because we have resources as a lot of primary care centers. We have, as a huge city, we invest money in different strategies to reach the population. So we have more than 470 primary care centers inside the city. We have around 12 million population, and we are conducting a kind of message of the absent child or even adolescent to the parent. So if you have any vaccine that is missing, a parent will receive a message in their WhatsApp. Every time everyone reach, if they want to pick up a medicine, have a clinic appointment, we have a contact with this person, if it is a mother or if it is an adult in himself or herself. How is your vaccine? We do this type of approach. And also, talking about campaigns, we have a lot of mobile clinics, especially where people are every day going to the metro. So in some metros, in some bus stations, we have these mobile clinics to reach, for instance, as you said, people that haven't had yet the yellow fever vaccine. But dengue is still, we are not allowed it by the NIP group to conduct inside the schools. So we are developing those other types of strategies to reach parents. And in São Paulo, if a parent say, "Oh, I don't have access," this is not truth, because usually we have the clinics open from 7 a.m. to 7 p.m. from Monday to Friday. And the 479 primary care centers, and on Saturdays we have the same hours in around, I would say, 80 primary care centers. And sometimes on Sundays we do a lot of campaigns, sometimes in parks. So if a parent say, "Oh, I didn't have time to bring my child," no, this is not truth. This so I do believe sometimes there are some other issues, as we mentioned, misunderstanding. Sometimes the parent doesn't understand the real burden of the disease to receive a vaccine. There are other factors that we need to fight against.
Melissa, I have my final question, very last question. I will leave the last one to Alicia. So you mentioned that vaccination strategy has not been done inside public schools and not even in private schools in Brazil. Okay, so not as a broad campaign. And you also mentioned about vaccine hesitancy, mostly for parents, right? So my question is there any strategy focusing vaccine education to the kids at school, not vaccinating them at school, which is we could do another podcast for that issue later on, right, Alicia? But
Yes.
Working on vaccine education at schools, public schools mostly, because we are talking about a scenario of new vaccines, emerging diseases. We have chikungunya striking Paraguay, Brazil as well. We have a new vaccine coming up for Latin America. So new vaccines are coming, new diseases as well. So very briefly, how could you merge this approach, teaching the kids about new vaccines and new diseases so we can prevent vaccine hesitancy in the future?
We have a partnership with Education Secretariat. So it's really important to teach the children about taking care about their health and also the health of the planet. So we do a lot of activities with children here in São Paulo City regarding how to block the mosquito and also the importance of immunization. And we set up a program that we have a huge success. We call in Portuguese Declaração de Vacinação Atualizada, is updated vaccination declaration, I would say the translation.
Or certificate maybe.
Or a kind of certificate, yes. And it helped a lot. Like the parent received this in the agenda of their child, and they need to go to the primary center to see if everything is okay, at least twice a year. So it's a kind of to show to the parents their responsibility and also our responsibility as a health secretariat. Like we are watching what you are doing for the benefit of the child. So many initiatives, and of course we are always open to think about new ones that we could improve the vaccine coverage for sure.
Excellent.
Wonderful, Melissa. So we're getting, unfortunately, to the end of this podcast, but I would like to give you the opportunity to leave one key message that you'd like to leave for pediatricians and infectious diseases specialists to take away from this conversation.
Yeah, thank you. First thing I would say, confidence is built a long time with reliable scientific communities, government, institutions, and population. In a future nearby, I do believe in a balance where we will still have sometimes political parties, social media owners trying to control narratives against vaccines, and then the scientific community need to stand up. Because as we know that, as Michael O'Brien said, confidence is contagious and the lack of her too. So it's our mission to build this net of protection for our society. Thank you.
Thank you so much, Melissa. Beautiful, yes. And that's the end of today's episode. Thank you again to our esteemed guest, Melissa Palmieri, for sharing her insights on how to tackle vaccine hesitancy as pediatric infectious diseases specialists. To find further resources and educational content, you can visit the Global e-learning portal on the WSPID website, your hub for pediatric infectious diseases insight.
Whether you are on your way to or from work or doing your school pickup, thank you for listening to WSPID Podcast. Make sure you're subscribed on your favorite podcast platform so you don't miss an episode. Please share this podcast with your friends and colleagues. Leave us a review and be sure to tune in next time.